nerve pain, tremors, nausea, weight loss, glaucoma, PTSD, Crohn's disease, and cancer. What do all these conditions have in common? They were all proven untreatable until medical marijuana. It has been discovered that medical marijuana dulls the pain of these conditions, making life a little more bearable for these suffering patients. This is one of the many reasons that show why medical marijuana should be legal in all 50 states. In this speech, I will inform you about how medical marijuana can help treat illnesses and symptoms, how the side effects of medical marijuana are minimal compared to other treatments, and how it can have a positive impact on the economy. First, we need to understand how marijuana can help treat illnesses and symptoms. Marijuana is made up of at least 65 chemical compounds, or cannabinoids. The two best known are THC and CBD, states Johnny Dodd, a writer for People magazine. THC is a chemical in marijuana that makes a person feel high, whereas CBD is a chemical that relieves pain. The CBD portion of the marijuana plant is what is referred to when discussing medical marijuana. The CBD chemicals in marijuana have little to no intoxicating properties. In the CBD dominant strains, there is no THC, so there is no altercation in consciousness. Also, patients who have been prescribed CBD report many benefits from relieving insomnia, anxiety, spasticity, and chronic pain. Now that we know how medical marijuana can help treat illnesses and symptoms, we will learn why it is better than other treatments. Opioids have the danger of overdose and addiction, whereas it is impossible to overdose on medical marijuana, and it is far less addictive. Peter Grinspoon, an instructor at Harvard Medical School, states in his article, Medical Marijuana, marijuana appears to ease the pain of multiple sclerosis and nerve pain in general. This is an area where other few options exist, and those that do, such as Neriton and Lyrica, are both highly sedating options. According to the data recorded by Grinspoon, having access to medical marijuana can reduce opioid prescriptions. In his article, Access to Medical Marijuana Reduces Opioid Prescriptions, he says it has been found that states who have legalized medical marijuana had a 24.8% lower mean annual opioid overdose mortality rate compared to states without these laws. Another statistic given by Grinspoon shows that states who have legalized medical marijuana saw a decrease in 2.21 million daily doses of prescribed opioids. Finally, we will go over how legalization will have a positive impact on the economy. When asked about the economic impacts of medical marijuana, Dr. N.J. Gasovic, a general surgeon at Sanford Hospital, states, "I suspect the answer to that question could be several books long." He continues by explaining that once you have an illicit market and make it taxable, there become many revenue streams as well as jobs for the community. The areas that are legalized have already seen their tax revenue increase. Dr. Gasovic also points out that in the interview that legalizing medical marijuana would have an impact for the people who would have gone to prison for use and possession. Decreasing this number saves society a significant amount of money. As we have gone over the benefits of medical marijuana, it is clear that it should be legal in all 50 states. Because there has not been extensive research done on medical marijuana, it is a divisive topic. However, the research that has been conducted shows great promise and has proven that medical marijuana is far safer than opioids as a pain-relieving substance. So go support the new drug policy reform or follow social media sites that support the legalization of medical marijuana.